What is going on, guys? Welcome to Medical Point of View. So, today we are going to talk about primary amenorrhea in detail and in the most easiest way. So, if you are ready, let's go. So, what is amenorrhea? Amenorrhea is absence of menstruation for more than 6 months in the absence of pregnancy in a woman of fertile age. Amenorrhea is divided into two types, physiological and pathological. Physiological is further divided into three types, pre-puberty amenorrhea, pregnancy-related amenorrhea, and menopause. Pathological is divided into two types, primary and secondary. So now let's know about primary amenorrhea. Primary amenorrhea is when girls fail to menstruate by 16 years of age with normal secondary sexual characteristics, or by the age of 14 when there is a failure to develop normal secondary sexual characteristics. Now let's talk about etiology of primary amenorrhea. Primary amenorrhea is caused by it is mainly caused by hypothalamic disorders, pituitary disorders, ovarian disorders, and endometrial disorders.
So, what's basically is hypogonadotropic hypogonadism? This is a medical condition characterized by inadequate functioning of the gonads, for example, testes in males and ovaries in females, due to a disruption in the normal secretion or action of gonadotropin releasing hormone that is responsible for stimulating the production of follicle stimulating hormone and luteinizing hormone from the anterior pituitary gland, which in turn regulate the production of sex hormones, for example, testosterone in males and estrogen in females. So, what basically happens in hypogonadotropic hypogonadism? There is a decreased gonadotropin releasing hormone secretion, and therefore there is a decreased production of follicle stimulating hormone and luteinizing hormone. Hypothalamic disorders can be caused by excessive exercise, weight loss, and stress. Second, hypothalamic lesions like craniopharyngioma, glioma, which can compress hypothalamic tissue or block dopamine. Head injuries, sarcoidosis or tuberculosis, drugs like progesterones, hormone replacement therapy, or dopamine antagonists. Now talk about Kallman's syndrome. Kallman's syndrome is X-linked recessive condition resulting in deficiency in gonadotropin releasing hormone causing underdeveloped genitalia, reduced FSH and LH, incomplete breast development and no body hair. Number 2 are pituitary disorders. Pituitary disorders also give rise to hypogonadotropic hypogonadism with the following causes: adenomas, of which podactinoma is most common, iatrogenic damage like surgery or radiotherapy, and congenital failure of pituitary development. Ovarian disorders. Ovarian failure is the cause of hypergonadotropic hypogonadism. It means it is ovarian hyperfunction. In hypergonadotropic hypogonadism, ovaries are not responding to FSH and LH hormone. Premature ovarian failure is a primary ovarian defect characterized by absent menarche. Endometrial disorders. Primary amenorrhea may result from Mullerian defects in the genital tract, including an absent uterus or outflow tract abnormalities leading to a hematocolpos. Mullerian ducts are paired tubes that grow into female reproductive organs early in fetal development. The ducts form the uterus, cervix, fallopian tubes, and upper vagina. Outflow tract abnormalities. Imperforate hymen represents one form of failure of complete canalization of the vagina, most frequent obstructive anomaly of the female genital tract. Presents with cyclic abdominal pain, abdominal swelling, and urinary retention. Hematocolpos is the accumulation of menstrual blood in the vaginal or uterine cavities, can create a pelvic mass identified on physical examination as a blue, bulging perineal mass. Turner's syndrome. Chromosomal abnormalities, that is 45X female, ovarian hypofunction and cause primary amenorrhea. Its presentation is primary amenorrhea associated with features of Turner's syndrome that are short stature, webbed neck, sexual infantilism, that is permanent lack of sexual development in an individual. The presentation of female with Turner syndrome are webbed neck, low hairline, small mandible, high arched palate, low set ears, and minimal breast development. And in ovaries, there is ovarian dysgenesis, which leads to amenorrhea and that can lead to infertility. Diagnosis is done by karyotyping. Another one is androgen insensitivity. It is a syndrome found in patients with XY chromosome but resistant to androgen. It has male karyotype that is 45XY but female appearance. Presentation is female appearance with normal breast development and external genitalia, primary amenorrhea, and absent uterus. Gonads are also present, that is testes. Presentation of androgen insensitivity patient with androgen insensitivity presents with scant or no pubic and axillary hair, but it has female breast development, undescended testes, uterine and fallopian tube agenesis, which leads to primary amenorrhea and infertility. In investigations, we do history and examination, which will guide us the choice and order of investigations. Pregnancy test if sexually active, blood tests for luteinizing hormone, follicle stimulating hormone, and testosterone, raised LH or testosterone suggestive of PCOS, raised FSH suggestive of POF, raised prolactin level suggestive of prolactinoma, thyroid function test, ultrasound to check appearances of polycystic ovaries, and MRI of the brain if the symptoms are consistent with pituitary adenoma. Karyotyping is diagnostic for Turner syndrome and sex chromosome abnormalities. Treatment of primary amenorrhea is according to the cause. In pituitary tumor, non-surgical treatment is bromocriptine. Bromocriptine blocks the release of a hormone called prolactin from the pituitary gland. High prolactin cause high levels of prolactin cause suppression of gonadotropin releasing hormone. Another method is surgical method. In androgen sensitivity, there is need to remove gonads and hormone replacement therapy is used to treat androgen insensitivity syndrome. Hormone replacement therapy is also used to treat Turner syndrome. Surgical incision is used to treat imperforate hymen, and surgery is used to treat hypothalamic lesions.
Thanks for watching. Like, share, and subscribe.